Apply. The worst you can do is not apply. My rule of thumb is when it comes to a job position, if I have 50% of the skills for that position, I'm applying. The other 50% I can learn in that position if they're willing to give me the opportunity.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. Today I interviewed Mickal Lewis, MPH, CHW, who is a Regional Community Engagement Specialist 7 at Texas Department of State Health Services. She's a multifaceted population health professional with 8+ years of experience in maternal and child health, public and community health, and emergency management. She got her bachelor's in public health at Sam Houston State University. She then got her master of public health at the American Public University System. In today's episode, you'll hear and learn more about the importance of realizing your worth and what you want from a job and shifting to get what you need, whether that's a higher salary or hybrid flexibility, the keys to building a personal brand, and specifically on LinkedIn, and how Mickal was able to unlock her personal brand, as well as she talks about utilizing the Army National Guard as an intentional choice and path to getting school paid for. If you enjoyed today's content, all I ask is that you hit that subscribe button, leave a review, and share it with a friend. It's really the best way to support the platform and get the show out to more people. Enjoy the show.
Hey y'all, this is Mickal Lewis, and I'm a Regional Community and Engagement Specialist 7, and you're listening to Public Health Careers.
Welcome to the show, Mickal. It is a pleasure to have you on.
Thank you for having me.
Yeah, I'm excited. I've been following all the stuff that you post or repost on LinkedIn, so I'm looking forward to hearing you, because I feel like there aren't many, like a lot of people that do a lot of posting around public health, but you are one of them that just stands out all the time. So I know that is like not the work that you do, but I think it's also very important as you're building like your personal brand, professional brand. So I'm excited. So how are you doing?
I'm doing well, and thank you for having me. I'm excited.
Awesome. I'm glad that I can have you on for you to tell more about your story and share some great insights. So as we hop into everything, like how do you identify and tell us a little about your personal background?
Okay, so I identify myself as a public health consultant. My background is in nonprofit management as well as emergency management. Currently, I am working with the state of Texas and their Department of Health Services. So I'm getting a little bit of that government political experience going for myself. So I'm definitely covering the full public health umbrella.
Love it. And I think I'm looking forward to hearing more about how all those insights come together to share more about your story and dive in more into like that nonprofit and the emergency management things, which I think is always important and need to be highlighted in public health.
Agreed.
So, Mickal, you have an extensive experience in community engagement for public health initiatives. Can you share some key strategies or best practices for effectively engaging with underserved communities, whether in rural or urban settings?
The key factor, and I will say this 100%, be honest. Don't promise something you cannot guarantee 100% to a community. Be straightforward, especially if you're coming in either from nonprofit or a government standpoint. Everybody in the community is already looking at you sideways. So be prepared to justify the work that you're doing, as well as just saying like, hey, we want to hear from you. You make the final decisions. We're not trying to make the decisions for you.
Couldn't have said it better myself. And I think like part of that being honest is like building that trust. And I guess to that point, do you have any like advice for people that are trying to go into new communities around building trust with those communities?
If you're going into the community, always reach out to, it's called CRCGs, which are community resource coordination groups. They're usually your backbone pillars, as well as attending community events. Go to those national night outs that happen at the most of the time beginning of October. Attend the fairs and the political events that are happening, because that's where you're really going to meet the people that are really making those decisions in the area.
Yeah, absolutely. Just trying to find places where those community leaders are and engaging with them there and like building that trust. And like to your point earlier, being honest with them about like what are your intentions, what are you trying to do, and just trying to stick to that word that you give them, I think is very, very important, especially when we're talking about marginalized communities.
I agree completely.
So I alluded to it before. I found out about you through LinkedIn, through I don't know, something that you posted, something that you reposted, something that you shared. You do a lot of that on LinkedIn, which I think is awesome, and I think like more people should be doing this. If someone was interested in trying to get more active on LinkedIn and just sharing more insights as a public health professional, what kind of advice do you have to give them?
Do what I did. When I was at the tail end of getting my bachelor's degree for public health, I just typed in public health on LinkedIn, went to the people's tab, and anybody that had public health or masters of public health in their title, I was adding them. I was connecting. I was leaving them a note just stating like, hey, I'm a public health professional. I'm just trying to better understand what you're doing in the area. And then that's just how I built my community just over time, just slowly but surely, especially because LinkedIn has their connections limit. Just introducing yourself, making that connection, because you never know who you might need to utilize in the future.
I love that. And is very similar to me in the sense that one of my goals when I started on LinkedIn was get into that 500 connections on LinkedIn. That I think is the first like milestone that you hit. And like to your point, it is so easy to find people with similar interest on LinkedIn. Literally just type in public health. If you're interested in nonprofit work, type in nonprofits. If you're interested in emergency management, type in emergency management, and then just like look to see who has like a bachelor's in public health or a similar degree, master's in public health, and then like connect with them, send them a short message. Hey, I'm a professional and I would love to connect and grow my network, maybe get to know you in the future. I think those are like simple things that people can do. And so many times we overthink it or make it so hard when it doesn't have to be that hard.
It's really simple.
And how about the on the point of like reposting or like sharing things, and how do you go about thinking about sharing stuff? Or is it just like, hey, this is interesting to me, I want to share this opportunity? Because I know you share jobs, you share other opportunities, you share other articles of interest and different things like that.
Usually, when I'm reposting a job, it's probably something I'm interested in. However, I'm not looking. So my network, I know, because people are messaging me off to the side saying, hey, this is my credentials. Can you help me find a position in this area with these recommendations? And so I just repost in hopes that someone in my network can find that new opportunity, especially with all the layoffs that happened last year. I will say that just finding those positions, I'm usually just teetering around like, let me see if I can elevate myself a little bit. Public Health Hired, I'm sure you've heard of Zora. She's a great network to have, as well as Dr. C.H. Huntley. I'm pretty sure you follow her as well. They usually present different opportunities, as well as some of the government websites. They'll have like newsletters that come out with internships, fellowships, full-time positions, part-time, government contracts. So just getting on those newsletters really help.
I like the point of view saying that I look for things that are interesting to me and then I share them. It's not necessarily saying that you're looking for a new position, but this is of interest to you. And like that is a filter for understanding that this is probably of interest to people that you're connected with, and then sharing that from there. Yes, love Public Health Hired. Dr. Huntley was one of the people that inspired me to start this podcast. So definitely know both of them. I would definitely recommend anyone in public health to connect with them, to follow their pages, as well as I'll put a plug for my newsletter as well. It'll be linked below, so to just click on that and sign up. And I do send out bi-weekly job opportunities, internships, and like other insights in public health. But the conversation isn't about me. Back to you. So before we get right. So before we get more into your collegiate journey and your journey into like public health, what does public health mean to you?
Oh, I wouldn't even say what public health means to me. I know my mission and goal in life is to help my community, wherever I might be able to progress and be able to advocate for themselves. So I guess to me, public health is advocacy, it's community, it's increasing the health of where we are.
How did you get to that goal and that mission in life?
Oh, I will say, and this is a personal story. So when growing up, single mom, she used to receive services from St. Joseph's or United Way, Salvation Army. So when I got my internship with United Way, that just seeing the operation and being able to understand how the organization ran, I was like, okay, this is something I can do for the rest of my life and be okay, of course, with the pay. Nonprofit does not pay as much as we would like, but it's getting there, guys. Um, but just having that motivation, knowing that although I'm not on the front end and seeing the help that I'm doing, I at least know I can help, 40 people. I can help 100 people, maybe even 400, and just making sure that number increases over time.
Love it, love it. And I think that that's a great perspective. And many people in public health probably have a mission or a vision. Many of us just haven't put it on paper or like been intentional in reflecting and thinking about it, because we are not coming to this work from a vacuum. We're coming to this work with lived experiences that make us want to do this work and want to help communities and make people and communities and populations healthier. So you got your bachelor's in public health at Sam Houston State University. What was the thought process of going into undergrad for you?
Well, the Bearcats. And I will say that Sam Houston State University is located in Huntsville, so it still gave me that small town feel of where I grew up, but also at the same time, it was 3 hours away from home, so I can go home if I wanted to. However, this is my home away from home, and I loved it. Um, and honestly, if you get the chance to tour it, let me know. I'll go with you. It basically just gives you that, okay, this is where I am. This is where I'm going to basically start my legacy in whatever career I decide to choose. So having the university behind me definitely prompted my career efforts.
And did you go into undergrad as a public health major? Like, what was that progression and like?
Oh, uh, I hate telling people this. Actually, we started studying for nursing, and I was just getting ready to go through the nursing program, studying for the NCLEX. And at that, what was it, my junior year, I was like, this is not something I can do. I do not have bedside manner. I need to abort the mission. And at the time, that's when the population health department was just up and running. So I went to my advisor. I was like, hey, what can I transfer all these credits to? They were like, oh, have you heard of population health, public health? No. Can I transfer my credits and then graduate next year? I got a yes, got a green light, and I was good to go that next summer.
I don't think that should be a story that you hate telling. I think that that's an important story because so many people might be in that same type of position and like have no idea what to do next. But you sharing that and saying, hey, this is where I was, and then I realized this was not for me. And I decided to make that pivot and I found public health, I think is important. And a lot of us find public health in very interesting ways. Many times it is through like wanting to pursue being a doctor or a nurse or a physician assistant or something like that, and then realizing that we can have this type of impact and do this kind of work from a different type of lens, a prevention type of lens. So thank you for sharing that. I don't think you should ever feel ashamed for sharing that. I think you should continue to share that story even more.
Thank you.
Yeah, of course, of course. So during your undergrad, you had a few positions. I'll talk about a couple of them, and then I'll come back to the United Way position. So
Okay.
you were a food service specialist at the Army National Guard, a Sigma 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 National Sorority, and an ARC leader to the Risk Management Coordinator to Rho Gamma. So tell us about those experiences.
Okay, so what is it? I did my freshman year, realized, okay, like school's expensive. How can I get schooling paid for? So I joined the Army literally 2 weeks after my birthday in March. And the only position, because they didn't have any medical positions open, was a 92 goal food service specialist. I was like, okay, I can go through training in September, be done by May, and I can get back into schooling that next August. So that was the game plan, which worked out perfectly for me. And then that year I came back, I was like, you know what? I really don't know anyone on campus, so let me just join a sorority. And so I was going through a rush, of course, that first couple of weeks of school, and I was chosen by Sigma Sigma Sigma, and still a proud member to this day. And through that opportunity, my third year in college, I was able to be a Rho Gamma, which is where you kind of give up your letters for a short time to help other potential sorority members come into the houses. And that's what the ARC leader was, as well as risk management. I was the risk management chair for my sorority, which basically, when we have our events and our day parties, just making sure everyone makes it to the event perfectly fine and everybody makes it home perfectly fine. Because technically, I'm reliable for all these people that are attending this event, so I want to make sure everybody is safe, sound, and lying their heads in bed by the end of the night. So that's really my lovely college experience.
Yeah, and that's a lot of responsibility, right? there. I can imagine. But shout out to you for like taking up that leadership space. And I definitely need to ask this.
Mhm.
So because I think this is like a question that continues to happen. Is like school is not cheap, especially graduate school is not cheap. You thought about it and you're like, okay, what's a way that I can get school at a cheaper price or discounted or free? And then you realize there was a way for you to do this through the Army National Guard. Can you tell us more about that process?
Yes, I like to tell people I was one of the lucky few. I joined the Army in March of 2013. I went through my training in South Carolina and West Virginia. And then once I made it back home, I was stationed in Killeen, Texas, which is, I want to say, 2 to 3 hour drive from Sam Houston State University. So I only had to commit to 1 weekend a month and then 2 to 3 weeks out of the summer to really just get my benefits, really. I will say that whole process, if you have a good group of leadership, I will say it can make your experience a lot better. Being food service, I'm the person everybody wants to come to because you get hungry. You don't want to make people mad. And so that was always really fun for me because, again, it's another leadership position. I'm basically running this kitchen. I'm serving this many people. And I have a nice little security clearance behind my back. So in case I get to cook for a mayor or a senator or maybe even the president, which I didn't get the chance to do. But that created a lot of opportunities to network, especially in the public health field.
That's a good point that you're making. And I think like people, especially students now, need to be very intentional in thinking about how they're approaching school. What are the ways that they can leverage other opportunities to get through school easier, as well as build those other connections and those other skill sets and the leadership skills, which are definitely very, very important. So I appreciate you sharing that. And like, if someone is interested, definitely reach out to Mickal. I'm sure she'd be happy to share more about that journey and like if you're a right fit for that type of path in public health.
Yes, I will say reach out to me. If you're going to message me and you want to schedule a one-on-one interview, please do it. Just send me some dates and times and I'll work with you.
Love it. You spoke to your mission and your why a little bit earlier on, having a single mother, being served by a lot of the programs, United Way being one of them. I guess coming a little full circle, you were an intern at the United Way of Brazos Valley.
Yeah.
Brazos Valley. Sorry for butchering it. So tell us about that, not only in the position that you were able to do and what you did in that position, but like what that meant for you to be in that position, knowing that your family was saved by United Way as when you were growing up.
I will say getting that internship was mind blowing. I was very surprised. I was like, oh, this is my opportunity. But during that internship is where I learned majority of my public health experience, where talking to the community members, being able to recite your goal and mission to stakeholders, whether that be a city official or a state official, setting up those meetings with senators. Also running programs. There was the Emergency Food and Shelter Grant, which not only did I take over that program, but I actually built out the grant distribution process. From that point, Baby Book Bash is what it was. It's basically like every child from birth leaves home from the hospital and gets their first book, because from birth up until third grade, most children aren't really read to. So being able to kind of also impact the future generation was also impacting as well. And then from that internship, I was basically able to lead the volunteer organization. So again, United Way really prompted me to really kind of hone in on my skills and expand my career field.
Yeah, and I could imagine that the leadership skills that you were gaining from like the Army National Guard, being responsible for all these sororas, they really helped you to I guess feel comfortable in being in that leadership role and doing this type of work, which I think is all important because we all our skill sets build on each other, and like we need to just continue to think about that in being expansive in the work that we do in growing in public health.
I agree.
Did you have any undergrad takeaways that you wanted to share with us?
Just remember you're there for your education. Even if you don't know what it is you want to do, don't just keep going to classes knowing that you hate them. Really hone in on, okay, so for example, I was very big on, I made my own schedule. I took it to my counselor and she just approved it. I did not let the college tell me what classes to take, because I think that's where students kind of get caught up in the, well, they told me to take this class and stated I need it, but it doesn't really pertain to my degree field. So really doing your research. You're an adult now. You got to do it. Mom and dad can't help you. So picking out your classes, making sure that if you eventually want to transfer or you're taking classes at the community college and transferring them over, just making sure they count, because this is your money. And a lot of people don't play about their money. So just being aware, I would say that's the biggest takeaway for me.
Definitely is an investment, and you should be the biggest advocate for yourself in this investment because it can lead you down so many pathways, good ones, not so great ones.
Mm-hmm.
So just really being an advocate and taking up all the opportunities during that time, because as we all know, you are paying for the schooling. So take advantage of all the things that you can during that time.
Mm-hmm.
So you got your Masters of Public Health at the American Public University System. Talk us through that thought process of going from a bachelor's into wanting to get a master's and pursuing a Master's of Public Health.
I will say I am very much a statistic of Black women who got bored. I graduated in May of 2017 with my bachelor's. And then by December, I was like, you know what? I can go for my master's. I can do it. And I registered within that same week and I started classes the next week. So through that whole process, American Public University System is specifically for military personnel as well as civilians who would like to transition into the military. So just having kind of people that were going through the same thing, like they understood like military, I have to take time off. Like sometimes I won't be able to do the assignment at the time you're needing, and just being that flexible provided an opportunity just for me to find my community. And even through that process, my mentor, you're actually assigned a mentor who helps you throughout your entire process. So that was really amazing for me because I believe I only got a mentor my freshman year in undergrad. So having one for my entire process and time at the university was amazing.
And what advice do you have for people around mentorship, both on being a mentor to someone as well as being a mentor for someone? Did I just say the same thing in two different ways? I don't know, but you know what I mean.
Yeah, I understand where you're going with that. I will say, as a mentee, just kind of knowing what it is you would like to do, even if it's not 100%, just having a specific either focus or milestone that you're trying to achieve with your education and your degree, and then having a mentor who aligns with what you're trying to do. And then from the mentor's perspective, there we go, I will say, of course, honesty. If it's not your specialty, refer your mentee to someone who could potentially help them, but also understand that your mentee is sometimes looking at you for guidance. Like you're kind of the big brother, the big sister that they're looking for help, and just giving them the good, honest, hey, maybe that topic's a little difficult for your dissertation or your concentration. Maybe you should focus on this because you have mentioned having experience with this, and just guiding them through that process, as well as kind of empowering them in the whole ordeal.
Good insights.
Mm-hmm.
Did you have a concentration for your Masters of Public Health? And it was just like a general degree?
Unfortunately, it was general. However, my work experience has been very either specific or tailored to certain areas, so that has helped tremendously.
And I think regardless of if your degree is in like a specifically biostats or something like that, or general, like to your point, there are definitely ways to tailor whatever internship experiences or the work that you're doing during classwork to really focus on things that are important to you or that you want to build skill sets around. So I don't think you should, it's something to be unfortunate about. It's just like what it was. And like to your point, like you were able from that to branch out and say, okay, I have this general knowledge of all these things. What are the opportunities that I can do to really build out my skill sets?
I agree. And I will say during my time at United Way was also at the same time I did my practicum. So keep in mind, United Way is a nonprofit. So that's where I got the nonprofit management experience. However, my practicum focused on emergency management. So I actually took that to my supervisor and said, like, hey, there's a 211 Texas call center that helps in times of disaster. Can I use my practicum as a way to kind of expand that program? And she said yes. So I was kind of able to double dip in that whole process.
Double dipping is great because I did the exact same thing because it's just less efforts on your side because you're already going to be doing that work. Why not try to do it in a way that helps you to get the degree as well? Some people will push back against that, get more experience, yada yada yada. But it all depends on your life, and really what you're trying to accomplish. And like sometimes we just don't have that capacity to take on another internship apart from like this work that we're doing. So yeah, if you're able to do that and if that's fine with you and you think you're getting all the value that you can get, like I advocate for that 100%.
Yes. And I was getting paid. I wasn't getting paid for my practicum, but I was at least getting paid for the other work I was doing. So if you can, try. If not, I understand.
Right. So you were the 211 Information and Referral Specialist at United Way of Brazos Valley, as well as you got promoted or shifted into a resource and project coordinator there as well. So you spoke a little bit about asking your preceptor at that point in time, like, hey, can I do this type of work? Can you tell us more about the work that you did and then the work that you did as a resource and project coordinator as well?
Okay, so during my internship, of course, I was working with my supervisor, who would be my manager as the resource and project coordinator. However, at the end of my internship, which I believe was in May, right when I was getting ready to graduate, there was a part-time information and referral specialist position that opened up that I have applied to. And I wasn't going to get it. But the person who was originally for that role ended up taking another position. So then it was offered to me. So I like to look at that as a blessing in disguise. And then from there, I was in that position for a year, and that's just taking phone calls, assisting the callers with local resources that are available for grant utilities, medication adherence, things such as that nature. From there, I then progressed to the resource and project coordinator, internal transition. And then from there, that's really when, I was helping with the 201 Texas database, keeping that up to date, which, if you know, that covers the entire state of Texas. So if you see information, not just for my region, but for another region that's out of date, you now have to be that person to say, like, hey, you need to get that updated because we're giving out incorrect information. So being able to have just kind of that professional conversation with another person who is basically doing the same thing for you, just in another area. And then from there is where my career really just took off.
And to backtrack a little bit,
Mm-hmm.
so let's say someone they have like either a job at a place or an internship at a place currently, and they're thinking of going to their supervisor, their preceptor to say, hey, this is a cool project that I want to work on. How do you how do you advise them to position that as they're thinking about it?
I would say, of course, make sure what you're asking aligns with what the company is trying to do. That's one. Um, if you're, I would say, consider it as professional development, because that's what you're doing. You're increasing your development, as well as having all of your information at the forefront. So being able to ask questions like, okay, like how much is this going to cost? Okay, there's no cost associated. Okay, what do you need from me? Do I have to keep a log for you? Okay, am I going to create that or are you going to create it? Just having all of the information up front, presenting it, and then saying, is this something you can do? And if they say no, that's okay. That's fine. Somebody will say yes. So don't take that initial no as the end all be all. You can always find someone else or another agency that'll be willing to assist you. However, it might be a volunteer opportunity. You might not be paid, of course, for doing that work.
Yeah. Those are just redirections. And I think it's important that you're saying this because many times we do feel discouraged when we do hear that no, but there's always another door that opens up when you get that no. And like to that point, you're still in the same position with that no. You still have like the job and the work that you're doing. It's just that you're not able to do this extra thing that you wanted to do, as well as being prepared before having the conversation. I think is important. Some people preemptively jump the gun and they like try to ask, but then they don't have the information, and then it just leaves a bad taste, you know. So like just being prepared and knowing all the things that you need to know before having that conversation, I think just makes it seem like you're more prepared to do it, as well as like just gives everyone more ease as you're thinking about this if they do decide to go that way.
I agree.
You graduated from your master's of public health. Were there any like big takeaways that you wanted to share with people throughout your MPH journey?
I didn't get a graduation, guys, because COVID.
Hmm.
So unfortunately, I just celebrated on my Zoom call. But key takeaways with the master's degree, if you can concentrate, of course, go ahead, do it. Especially if you're specifically focusing on epidemiology, of course, you want to have that concentration. But if you can, I honestly love having the general opportunity just because I'm able to do so much. I'm so versatile and just about anything I'm willing and wanting to do that it shows future employers as well as previous employers like, hey, okay, she does know what she's talking about. She doesn't just have a degree behind her name, but she has the experience and the knowledge to follow up with it.
Yeah, and it allows you to be like just a little more multidimensional in the work that you're doing, and like to the point of like the general degree just gives you a good foundation to build whatever skill sets you want. If you wanted to do epidemiology, just like get an internship doing epidemiology type stuff, and then there you have it, you know. So yeah. You graduated, and your first position after graduation, if I'm not wrong, is you were a population health coordinator at BVCAA, doing business as HealthPoint. How did you come across this, and what did you do in that position?
Okay, so my position at United kind of got a little toxic, especially after Hurricane Harvey, unfortunately. Tensions were high, and if anybody has ever worked in a call center, you understand the stress, just the back and forth, meeting metrics, things such as that nature. So I felt like at that point, I had maxed out what I could do for the organization. So I started looking at other opportunities that were available. And I came across the population health coordinator position at HealthPoint, we'll call it that for short. And then from there, I came across that position on LinkedIn, I want to say. LinkedIn and Indeed kind of get mixed every now and then. But from there, that's really where my Excel experience came in. From that point, it was like the first 3 months of my position as a public health coordinator, because I had to create pivot tables, I had to create all these graphs just to kind of show what it was the project we were working on. I basically got on Microsoft offers courses. So I took those first 3 months of my position and I learned everything I could about Excel from top to bottom, left to right. So now I consider myself an expert in it. And that's what progressed me. I will say, because we focus on A1Cs, diabetes, mammograms, colorectal screenings. So being able to kind of look at that data, tell the story, and then better adjust to how we can help those community members, especially because the insurance companies were offering incentives to kind of pay the patients as well as the providers for getting those patients into a healthier score, I will say.
And I've seen that be more and more normalized across the health insurance world ecosystem. And I think like it's kind of obvious for public health people, because like if you take care of people on the front end, then you don't have to deal with treating them on the back end, and then it saves health systems, health insurance money. But hopefully like that becomes more obvious for everyone in the work that's happening. But yeah. And what is a pivot table if someone didn't know what that was?
Oh Lord. Okay. No, specifically, I can show you better than I can tell you. That's what because I don't know how to think about it. But I will say a pivot table is just it's a graph that takes the data as well as the numbers of information and kind of just creates this beautiful, I call it beautiful. I love Excel, sorry. It's this beautiful diagram that you can say like 96% of this age group is showing that they have an A1C higher of 6. And it can show you like, okay, this is where it's happening across years or months or even a couple of days.
Okay, well, thank you for that description without the graphic. I think it made sense, and you clearly showed what that could be used for.
Thank you.
Yeah. So after this position, you shifted into a community engagement navigator role at the Rose. Tell us about how you came across and what you did in that position.
Okay, so funny story. I was actually 6 months into my population health coordinator position. And because I was a community engagement navigator in that position as well, I got an email from the manager, the hiring manager for the community engagement navigator. And they're offering $55,000. So I was like, oh, that's 20 more than I'm currently making at this point in time. So I'm going to apply to that. And it was hybrid. And it was specifically to the region I had already been servicing for the past 6 years. So I applied. At the time, she was like, does your manager know you're applying for this position? And in my head, I'm like, no, come on. You know better. But I was able to have that conversation with my manager after the interview, and I was offered the position to say like, hey, unfortunately, this opportunity just provides one, a higher salary, and then two, this is my transition into remote work because it was a hybrid role. So that's how I came across that.
Yeah. Important insights. I think we shouldn't get caught up on those types of things. Like it's important for us to advocate for ourselves and see like what is the best for us at this point in time. And our managers don't particularly need to know that information until they need to know that information. so like yeah, to your point, like that you will let them know that when you have that offer. And like I think that could even be like a negotiating bargain that you have there with them if they are open to that kind of conversation. But yeah, like seeing that there was an opportunity for the work and like in very similar way that you were doing the work before, just compensated you better, which I think is something that we should all be looking for in our jobs and our roles. So shout out to you for navigating that and being able to do that. So was it like pretty similar in the roles and responsibilities?
Yes, so I basically still covered my 7 counties that I have been covering since I worked at United Way. However, I would just be focusing on mammograms. So scheduling those mobile mammogram units to go out to those rural communities and assist those women who either did not have time to go to the doctor and get their mammograms done, or it was they didn't have transportation. So the mobile unit would actually go to a particular area where it's like, hey, can you get transportation to this HEB? We'll be in this parking lot from 9 a.m. until 3 p.m. So you can come on your lunch break, we'll work with you, or you can have a specific time slot and we'll get you screened and then let you know if there's anything to be concerned about. That was my main focus.
And since you've had both of these roles in like community engagement, navigation space, like if someone wanted to get involved in that type of work, like what kind of skill sets would you tell them, or like what kind of experiences would you tell them to try to go after to build that skill set?
I would say, so I know the state of Texas offers the community health worker certification, which it's CHW. So it's basically just focusing on community engagement, community navigation, which includes being able to identify resources in your area and kind of advocating on behalf of whomever you're helping get to that resource. And then follow up. Like, hey, remember I asked you to contact so and so with this organization. Have you been able to contact them? And if they say, like, well, yeah, I called, but they said they were out of funding. I'm like, but it's the beginning of the month. Every program kind of reallocates their funding at the beginning of the month. So you should try calling again to see if they can step in and help. So just offering that, I guess, empowering that person to be able to advocate and say, like, no, try again. And then if for some reason they're still hitting roadblocks, okay, 1 second, I'm going to give them a call. And I'll call on behalf of them. And I've done that for a few people where it's like, hey, they're telling me one thing. Can you just provide me an update? And sometimes, especially when it comes to homeless shelters, a lot of the restrictions is drug use. You cannot be on drugs or have drugs in your system at the time of housing, which some people don't want to disclose that when they're asking for help because of the stigma and they get looked at differently. So also having empathy, don't just show sympathy, but having empathy and being able to just help as best as you can.
Yeah, important rules, and I think, like, especially when we're thinking, because a lot of us in these types of roles have some sort of level of education and experience navigating or like knowing where resources are in a system.
Mhm.
But then when you have the lay person who is just trying to get by in life with all these barriers and all these different things that are happening, that one phone call that discouraged them might be the end of them trying. But like you, as you said, like just standing there with them and empowering them to know, like, hey, since you reached out at this point in time, but there's another point in time that might be a better time for you to reach out to get the services and get the support that you need. Let me help you with that. And like even going as far as to like giving the people a call and saying, hey, this is what I know, this is what this person's telling me, like, please fill me in this gap so I can really help and support them, because this person is still in need of whatever support it is at the end of the day. So yeah, I appreciate that. And like, I think that's awesome work. And there's a lot of that work that is going on now and just continues to go on. And it's such important work to do, because many times even us as public health professionals, we don't know all the resources that are in our communities, and then we expect other people who don't have any knowledge about the systems to know about the resources, which doesn't make sense. So it's like, how do we get and meet those people where they're at to share with them the resources that are available, that are essentially there for them to use? So important work. So I appreciate that.
No. And then let's see. I'm going to jump the gun. I'm going to say, and then transitioning from a community engagement navigator position, I was able to find my senior program manager contract on LinkedIn. It was a 2-part contract. So Partnership for Southern Equity, as well as the BLK+Cross out of Atlanta.
So before you get into like that, what does a 2-part contract mean?
Okay, so when I originally applied, I thought it was one position. That's what I get for reading's fundamental. I thought it was just a contract with the BLK+Cross where it was 20 hours a week. You know, I could do my full time, I could do my part time. Nobody would ever know. Well, my first week of starting, I realized, oh snap, I have 2 managers I have to report to. Oh crap, I have to work 40 hours on top of my full-time position that I'm currently doing. What did I do? In a contract, you're locked in for a year unless you give that 30-day notice. So I was like, you know what? I'm gonna do it. I'm paying off debt. It's fine. So a 2-part position is when 2 small nonprofits come together to share a contract position. So for Partnership for Southern Equity, I focused on climate change as well as health equity in 6 zip codes in Fulton County, Atlanta, Georgia. And then on the other end with the BLK+Cross, I was focusing on COVID awareness because that was the height of COVID, being able to kind of provide advocacy and education on the vaccines. And then I was also running the newsletter for the BLK+Cross that they sent out monthly, I want to say. It was a while ago, sorry. But yeah, that's how a 2-part contract works. So you basically are doing 2 jobs, however it's 1 position.
That's fascinating. I don't think I've ever heard of that. It makes sense. It makes sense. It makes a lot of sense. But I don't think I've ever heard someone say that. So I appreciate you sharing that first of all. And like for you going into that position, how do you manage that? Because like I know sometimes even managing one manager, like having one manager could be difficult. So like how did you manage having to report to two different people doing two different like roles for two different organizations?
I will say that thankfully they used Asana, which that's another skill set, just understanding different platforms and tools. Asana is a platform that kind of just shows, okay, this is my deadline for this project. These are the steps and the tasks that need to be done in order to accomplish this. So both organizations use that same platform. So I just had to make sure everything coincided and that I stuck to the timeline. If at any point in time I did not stick to the timeline or my schedule, things got a little topsy-turvy. However, a lot of this work took place. I was working during the day, so a lot of my work for these organizations actually took place in the afternoon. So I was really able to put that 40 hours and really just focus on this contract. And what one of the biggest aspects of it, I will say, was each organization, so PSE, Partnership for Southern Equity, and then the Black Cross, they each had their own coalition groups. So I was also running that late at night. It's 8 o'clock, my stomach's growling. So I was in those organizations, and it basically housed the community pillars, those stakeholders, those pastors, the judges, the police officers that are in the community. That was the meeting where it's like, what do y'all need? What can we do? What's the next project that we can focus on? And just highlighting, I'm from Texas, so I'm not there physically. However, I can definitely help you kind of progress this project forward. I got looked at sideways a couple times from being from Texas, but I'm still in the South, so I think it helped.
I definitely think that helps as well, and that's important. And I think coalitions are so important. Like it's bringing together a lot of people. And one of the hard things I know that happens with coalition is like how do you keep the momentum, and like having someone in that role such as yourself that can really like help people to just keep moving. Okay, these are the next steps after this meeting. This is what we talked about. This is what we have to do next. And just like ticking those things off and keeping people motivated and interested is a hard thing to do, but important work to do. And I think networks and coalitions have a lot of power. And I think they are essential for like a lot of the work that we need to do in public health to get to better health improvement, better systems change. So that's awesome that you're able to do that.
Thank you.
And you mentioned that you did climate change work and COVID awareness work. How did you like learn those topic areas to be able to be effective in those work in those roles at the different orgs?
I hope the public health community doesn't come after me, but I knew nothing about climate change going into that position. I still am very uneducated when it comes to climate change. However, I still actively read articles to kind of help me understand what it is organizations are trying to accomplish, as well as when it came to COVID-19. I understand the Tuskegee process and understanding people's hiccups and concerns, as well as why they were avoiding getting the COVID-19 vaccine, and just sympathizing where it's like, I understand. However, if you don't get the vaccine, this could potentially happen to not only you, but your family. Being able to emphasize wearing a mask. If for some reason you don't feel comfortable wearing it, can you take that extra precaution in distancing yourself from other people who are trying to protect themselves from the vaccine? So just getting to the community's level or getting to an individual's level rather than kind of just pushing like, hey, you need to mask up or you need to vaccinate. That's not for me to tell somebody to do. That's their body, that's their choice. I'm just providing them the knowledge and the information and hoping that they hear it.
Golden rule in public health: meet the community where they're at.
Yep.
And yeah, important work as well. So you were after this role, you became a public affairs manager at Harris County Toll Road Authority. I believe this was for a very brief stint in time. So tell us about that.
I will say that it was very short-lived, unfortunately. I started that role in it's this year, January of 2023. I was actually laid off in February of 2023. First layoff in my 29 years. So of course that was heartbreaking because I was like, what did I do wrong? However, it was not a me issue, it was a they issue. So just understanding that aspect and realizing that although I didn't get the experience in the public policy role, I'm now in a government position now. So again, a blessing in disguise that I did not even know of.
And how did you deal with that termination, or like reframing it to think, hey, it's not a me issue, it was a they issue? How did you deal with that?
I cried. I cried a
That-
lot.
that's reasonable, very reasonable.
But thankfully, I was smart enough to kind of see the writing on the wall. So my first week in the role, I already knew the job may not be there for the long run. So I had already been applying to other places in the process. So that's where I think I caught my saving grace. I was already applying to positions and interviewing. So when the layoff happened, I think I was unemployed for 3 weeks, which not a lot of people can say that, especially with the recent layoffs. They've been without work for 2-3 years now. So again, very grateful.
Yeah, but like to your credit as well, just recognizing that, hey, something is up here. Let me keep the options open. Let me like still look at what opportunities out there and apply for those opportunities. And I think someone says, I don't know who the quote is from, but it's like you have to start networking for your next position when you get into your new position. So it's like always keeping your eyes open to like what are the opportunities out there, not kind of closing it down, because as we all know, the world is a crazy place sometimes and we never know what's going to happen.
Also true.
So you moved into directive community health and safety at East Harris County Empowerment Council. This was also for a brief stint. So, so tell us about that.
You're just calling all of my stuff out. All right. So
it's publicly available on LinkedIn. Publicly available on LinkedIn.
Don't judge me. I like job hopping. I'm sorry. So
nothing wrong with that.
Unfortunately, I did like that position. However, it was on site. And for anybody who has ever worked remote for 4+ years, going back into an office is daunting. And at the time, the director had a very sensitive nose. So he had really bad allergies. And I like to smell good. However, I also chose perfumes that were like allergen friendly, and he still could not tolerate it. So I then got my current position as the Regional Community Engagement Specialist 7 for the Texas Department of State Health Services. And within the 2 weeks that I was already in the office, I was like, hey guys, this isn't a great fit. Thank you for giving me the opportunity. Because I did feel bad leaving that position because they were building a lot of the programs around me just based on my skill set. However, my current employer was offering $10K more, and it was a hybrid remote position. So I was like, I love y'all, but I gotta go. Okay, bye.
These are the important conversations that we need to have in public health, because at the end of the day, we saw the job layoffs before. Like, jobs are gonna drop you if they need to drop you. So like, we should also take that perspective and say, like, if this is not a good fit for us, like, it's not a priority for me. And like, to your point, you've been working remotely for 4 years and then going back to that situation, as well as like having a boss that didn't like your perfume. That's on the hinge of like ridiculous. But that, like, yeah. So either way, I'm glad that you were able to share that. And like, before we get into your current position, like, talk more about your thought process or your idea around like job hopping, and like, to your point of like looking at opportunities and saying, hey, this is offering me something that is more suited for me, whether that's a higher salary or hybrid work or remote work.
If you can jump ship, jump ship. I'm sorry. That's my motto. That's my mindset. I know a lot of people won't agree. They'll say stay there for a year or two. Look, if you're there for 6 months and you know that job is not cutting it, it's time to go. Life is too short, so do not sacrifice your mental health, your well-being, time with your family when you could be doing something you're happy to do. And that's just what I stick with. If at any point in time, like, my antennas start going off, It's like, all right, I'm applying other places now. What's next in this journey? Do I have to answer for it in interviews? Not necessarily. Nobody's ever questioned why I've switched roles so often. I'm just really good at speaking and communicating what I've done that I don't think it's ever been questioned. As well as I highly recommend people to take a negotiation course, preferably one online, YouTube University for free. Just get comfortable negotiating, saying if they send you the offer, you don't have to take it. I want 5K more than what you're offering. Oh, that's not something we can do. Well, go ask. That's what I told my current employer. I was like, well, can you ask first and then bring it back to me? And they were able to increase it by 3, but lo and behold, 6 months into the position, we got a 5% raise. So I'm at the salary that I asked for when I was hired on. So you don't ask unless, ask. And if you get told no, it's no. But keep asking. Somebody's going to say yes.
That's very, very important. I think, especially as someone that is a person of color in this world, it's like always negotiate your salary. That's something I'm learning. Always, no matter what they tell you, always negotiate your salary. And if you can negotiate your salary, there are always other things in the job that you can negotiate. And like to your point, ask them to ask, because many times the people that you're speaking with aren't the people that are part of the HR team that can actually say, hey, yes, we do have that wiggle room to give you that. So yes, be an advocate for yourself, take those negotiating courses, whether that's YouTube University or LinkedIn Learning or whatever it is. But I think this is one of the skill sets we also don't think about a lot, but it is used in pretty much everything, whether that is from job searching or just like talking to someone. I think like negotiating or communicating in a way that kind of persuades someone is an important skill set to have, and being able to stand on it and be happy to advocate for yourself is very, very important. Also, they wanted to highlight the point of you saying, because I think a lot of people in their mindset is like, oh, if I leave this job within a couple of months, someone's going to ask me this about it. Someone's going to ask me this in the next interview. And like, to your point, like kind of address it firstly and just say, hey, this is what I did. And like, this is what I gained from it. This is where I am right now. And just like being open to that, because many times it is a non-issue, and it's just an issue that we have in our head that keeps us back from taking those leaps into another position that might be a better fit for us.
Yes, please leave.
So what do you do as a Regional Community Engagement Specialist 7?
Ooh, that's a lot. Even with the 6 months, I'm still learning. I will say that I cover Region 65 South in the state of Texas, specifically counties surrounding Houston, particularly 3 counties. I won't say which 3 in case people are listening. But primarily just bringing in those state resources, understanding what it is the community is looking for. For one of my counties, they want to focus on diabetes awareness. For another one of my counties, they want mental health. And then for my last county, they're needing help with food insecurity. So being versatile, knowing the resources that are available. If you don't know, you need to be finding out, okay, who do I need to contact in order for this resource to come to this area and speak to the community members or the stakeholders who are providing services to those residents. And basically just advocating, meeting with county judges, meeting with the mayor, state officials, letting them know like, hey, I'm in your county. This is what I'm trying to do. I would love your backing, or at least your understanding and knowledge of knowing what we're doing in case people come to you and they're saying like, well, what are they doing here? Especially working for a state department. People are already on pause. They don't want you anywhere near them. So just reiterating, I'm here for you. What do you need? Let's see what resources are available. If there's grant opportunities, making sure that the community is aware so that they can apply for those.
And going back to the beginning of the interview, like be honest and be open, build that trust, and just share where you are actually coming from. And that's where people would start to believe and trust in you. So thank you for sharing that.
Yeah.
And you've also been an independent public health consultant for, I think, 6 years or so, doing a lot of work with like coalitions and project monitoring and evaluation and other things. Tell us about how you got into that and like what have some of those experiences been like for you over the last 6 years.
I'll say it goes back to the beginning. Dr. C.H. Huntley. I took her class. I've taken her class almost every single year she's offered it. I have yet to create my own LLC and all that aspect. I'm really just liking utilizing LinkedIn, offering some of my services for free, meeting with public health students, being a mentor to public health professionals and assisting as best as I can. But really just making sure I'm true to myself and true to public health within any capacity. I will say that consulting work is not for the faint of heart. You cannot just do this on a whim. You have to be very consistent. You have to be concise, especially if you eventually want to transition into government contracting. You got to know your stuff, because one thing the government doesn't play is once they pay you, you got to be able to show your outcomes. And also just honing in on your skills, Asana, Excel, any type of Microsoft software. You can even do Google Suite, where it's like the Google Sheets. Just having that knowledge and that skill set really puts you in line as a top candidate when applying to those positions.
Yeah, that makes sense. And yeah, government contracting is like definitely next level. It's not something to go into just like willy-nilly. It's like you really have to know your stuff if you're trying to get into those kind of positions. And I think like everything you said is great. And like if you are interested in that type of stuff, I would always advocate that you do like subcontracting or like talk to a consultant that's already doing it, just to get a better understanding, because you don't know what you don't know, and the only way to know more is to put yourself in those kind of positions where you're able to learn from other people that are doing the work already.
I agree.
So before I move you on to the Furious 5, 2 quick questions. Where can people connect with you, and where would you like to see yourself in the future?
Ooh, okay. So specifically connect with me on LinkedIn. Once I get a feel for you that you're not a little on the crazy side, then I'll share my other social medias with you, as well as email MickalLewis@outlook.com. I guess we'll put that in the cliff notes on how to spell it, just in case. And then where do I see myself in the future? Honestly, I'm kind of waiting for an employer to pay for my doctorate. Like, I want to go for it, but I don't want to pay for it myself. So really, my main goal right now is to finish out this contract with the DSHS, and then from there transition either into a full-time regional employee or finding another home with another agency doing the same work.
I love it. And just can you touch on a little bit about like thinking through that doctorate program? Like, are you thinking PhD, DRPH, another doctorate in another kind of space, or like, what are you thinking there?
I'm actually thinking maternal health. So I actually did my capstone on African American women in the United States and the mortality and morbidity rates. Unfortunately, there's not a lot of data that's recent. Everything is over 10 years old. So being able to kind of focus and concentrate and really helping rural communities as well as urban communities reduce those mortality rates, especially being a minority, helps tremendously in the long run, as well as it keeps, by the prevention aspect, it keeps people out of the hospital in the long term.
Okay, awesome. Well, we look forward to seeing where you do end up there, and we are wishing you all the best on that journey. And I think, like to your point, tuition reimbursement should be something that is more widely available in jobs, because I think that is something that can attract a lot of people that would want to work for an organization while also continuing to build their experience and knowledge and expertise. So yeah, we will see where you go, but we are looking out for it. So thank you for sharing that.
Hey, add me on LinkedIn. LinkedIn will know before everybody else.
LinkedIn eats first, everyone. LinkedIn eats first. Okay, so moving on to the Furious 5, the 5 questions that I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Ooh, I will say know what it is you want to accomplish in public health, whether it be helping community members, helping women, helping children. having that key point will be your driving factor on what you do.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Apply. The worst you can do is not apply. Even if my rule of thumb is when it comes to a job position, if I have 50% of the skills for that position, I'm applying. The other 50% I can learn in that position if they're willing to give me the opportunity.
Love that. Number 3, what's something you are working on improving in your life right now?
Ooh, I'm actually working on my Lean Six Sigma green belt right now. So just increasing my professional development and my skill set.
Yeah, and I'll link that in the description for anyone that's interested. I think like that is also like a great way to build out like more skill sets, experience, and like just show that you're someone that can do work. Tangible certifications are always awesome. Number 4, professionally, do you recommend anything besides people connecting with you on LinkedIn?
There's the 101 plus public health jobs book. If we can link that also. That book is highlighted, written, scribbled in, and I've had it for the past 9 years now. And that has really helped me hone in, like, okay, this is what I want to focus on.
Yeah, I love that book. I'm actually in the new edition that came out a couple years ago, so definitely I will link both the old edition and the new edition. But yeah, I definitely recommend that book. It gives you a lot of information about public health jobs, the different avenues that you can take, and just learning from people, as well as like actual people in there that you can reach out to and make connections and ask them
I'm
questions.
gonna have to get the new edition. Okay, I didn't know that. My apologies.
No, you're fine. You're absolutely fine. And last but not least, if there was one piece of advice you'd give to your younger self, what would that be?
Go back to nursing school. There are honestly days where I'm like, I should have just finished out with nursing. I should have just did it. I should have sucked it up. But at the same time, I only say that because of all the public health experience I have now. I can now apply it to nursing. But who knows? I might go back to school for a nursing degree instead of a doctorate. Stay tuned.
We are staying tuned. We are staying tuned. That's awesome. But thank you so much for coming on, Mickal, today and sharing your insights, your knowledge, and your journey with us. I think it was very informative.
Thank you, and thank you for having me.
It truly is my pleasure. Housekeeping items, everyone. Thank you all so much for listening or watching this. Be sure to subscribe if you have not as yet, and share it with a friend. This really helps the show get out to more people and helps other people learn, navigate, and transform their public health careers. So please do those things, and I will see you all next week. Peace.